October is Breast Cancer Awareness Month, and Arkansas ranks 37th in the country in terms of women getting their annual mammograms. Our Sarah Doan spoke to a doctor about how life-saving these exams can be.
A woman who is screened annually, she reduces her risk of dying from breast cancer compared to women who don't get screened by 50%. Wouldn't you want to improve your odds by 50%? I would.
This is Dr. Sharp Malik, a breast imaging radiologist at St. Bernard's Imaging Center and an advocate for early detection. He says an annual mammogram can catch the disease early before it spreads throughout the body.
The highest risk factor of getting a breast cancer is being a woman and aging. If we took all the women we diagnosed with a breast cancer, 75% of them don't have a family history. And their only risk factor for getting a breast cancer is the fact that they're a woman and they have breasts.
Dr. Malik says the more advanced the cancer is when detected means the more aggressive treatment options like radiation and chemotherapy. Women with a family history of the disease are at a higher risk for developing it, meaning screenings should begin at a younger age.
We need to do that risk assessment at age 30 because they may need screening before the recommended 40.
Roughly a third of Arkansas counties are without a healthcare facility that provides mammography, an X-ray that detects the most common cancer diagnosed in women.
That's around 100,000 women across the state that don't have ready access to mammography.
St. Bernard's is helping fill the gap through their mobile mammogram unit that travels to 23 counties in the region, providing the exam to women who are underinsured or underserved.
Many of them would never have had a mammogram because they couldn't afford, or they didn't have the transportation, or they couldn't leave their family to come and travel and get their mammogram, but we're taking it to them.
Each year, the mobile mammogram van diagnoses around 24 women with breast cancer across the region, making early detection vital.
We can't prevent breast cancer, but we can prevent women from dying from breast cancer if we find their cancer earlier enough and use the tools that we have available. It's a second leading cause of cancer-related death, and it's not something that we can ignore, and it's not something we just need to think about in October.
The St. Bernard's Imaging Center has a photo wall of breast cancer survivors. Dr. Malik says while it is a scary diagnosis, the wall serves as a reminder of hope for current patients battling the disease. Sarah Doan, Northeast Arkansas News, Jonesboro.